Hey everybody, Dr. Rob here. Once again, Facebook Live. You're going to love today's. So do me a favor. We're going to talk about blood tests that can save your life, and they're all about cholesterol. So, with all that being said, punch share. Tell your patients. Tell your doctor. Tell your friends. Tell your family. Please, punch share. We're going to take about 20 minutes and go through this. Press like. So here we go. Cholesterol, is it a friend or a foe? When I grew up, it was the worst thing in the world. You weren't supposed to eat any. Your body produced enough of it. It was the worst thing in the world that could happen. It was a guarantee that someone was going to have a heart attack. Because since 1971, we all know that we had to watch fats and eat carbohydrates. Well, guess what? Here's one takeaway as I go through it. Fat isn't going to make cholesterol. Sugar is. So let's talk about cholesterol. Is it a friend or is it a foe? Well, fact, cholesterol is the precursor of every cell membrane. Cell membrane is a key component. Cell membrane health is a key component to overall health because cell membrane enables nutrient ingestion and toxic egress. The healthier cell membrane is, the healthier you are. Number 2, steroid hormone. Yes, it is. It also aids in bile acid. It also helps with vitamin D. It is truly only problematic when oxidized, when you're inflamed. And finally, increase in insulin is bad for cholesterol because sugar leads to an insulin release, and insulin will enable you to oxidize and plaque and stick cholesterol to arteries, cell membranes, and organs. So let's move on a little bit. Page 2, here we go. Elevated cholesterol, not a total cholesterol, but specific kinds of cholesterol, which we're going to get to, is an important risk factor for heart disease and stroke. As we age, cholesterol gets higher, but then again, so does our incidence of what? Diabetes, higher blood sugar, insulin resistance. So you're going to see a direct correlation with adverse effects of cholesterol as we age because of adverse effects of sugar. So right now, if you're drinking a soda, put it down. If you're thinking about having something sweet, reconsider. So here's your traditional tests. Man, it drives me crazy when my patients come in and say to me, yeah, my total cholesterol's high. Doesn't mean that much to me. Yeah, my HDL's this and my LDL's that. So first of all, let's go over and let's talk about what is total cholesterol. It's all your cholesterol floating around. So 200 is usually the marker. If it's higher than 200, people say total cholesterol's high. HDL, happy, good stuff, should be high. Remember the H. That's your good cholesterol. LDL, L, lousy, should be low. So if you have 200 as your marker and you're at 220, if you had 110 HDL, which is extraordinarily high, and 110, which is positive, and 110 LDL, which is slightly high, in a 1-to-1 ratio, you wouldn't have a cholesterol problem. So that total cholesterol marker is virtually antiquated. Now you're only going to use it in ratios in reference to some other markers. And you're going to see all about the breakdown of HDL and LDL, or as I get into it, the particle size. Antiquated. Everybody ask your doctor. Call me. I prescribe for blood. Call me and we'll talk about the specific tests that you need to take. And here we go. Leading edge cholesterol tests. Number 1, APOA1, protein located in the good cholesterol. It's all your good cholesterol. It's not just HDL. There's 3 different, and actually up to 5 particles of HDL. Some are better than others. So your APOA, A like Fonzie did, 1 is your good stuff. It's your total good stuff. APOB, B, bad, easy to remember. It's your protein all located on your bad LDL cholesterol. This is a mistake. My wife made a typo and now she's going to see it and I'm on the couch. But nevertheless, it's bad LDL. No problem. So remember, APOB bad, APOA all the good stuff. So you take this ratio, APOB over A1 ratio, the lower the ratio, the lower the risk. Because as we all know in math, the higher the bottom is the lower the number. That marker itself is twice as effective as predicting a heart attack than the traditional test from before. Twice as effective. So please, by the way, my understanding is insurance does cover this. So if there's one of those little questions, I can see John in the back already like letting me know there's a question, which we always field at the end. Insurance covers this. So let's move on. It gets better, guys. So here's LPA. This is determined by your genes. Yes. I'm a big believer in epigenetics, the changing of gene expression in generations by good health, supplements, diet, and exercise. But genes still play a role as minimal as 10% and up to 30%. With that being said, LPA is your genetic marker. We're not going to have a great outcome with this through changing your lifestyle. This is the one little caveat. Sorry, but everything else we can help and change. SDLDLC, the particle size. This is the key component to LDL. So when you take that traditional LDL test, it's not the amount of LDL, it's the weight. So what you want in LDL is you want a bigger particle. Because the bigger it is, the harder it is to get under the artery and plaque out. If it's bigger, it sticks to the outside and we can get rid of that. So the particle size, so clearly we don't want small LDL particles. That doesn't make a lot of sense because they can kind of like go under the artery, like you could put dirt, small dirt under the rug. And as it builds up, it plaques out in the carpet. Same deal in the arteries through your body. Whereas if it's on the outside, through nutrition and exercise, you may be able to get it away or wash it away, etc. So I said LDL is weight. Here's my scale. You've got 3 big LDLs right here. You've got 13 small ones and they weigh the same. So somebody says, oh, your LDL marker is good. It's 99, less than 100. But when I test for it, or what I recommend to test, I want to see if they're small or large, because the small is deleterious. It will injure you. It's easier to plaque. LDL, the big issue with LDL is the size. We don't want it small, we want it big, and the traditional test doesn't have it. You can now ask for the LDL particle size. So let's look at some ratios. You can take your HDL, your good cholesterol, over your total cholesterol ratio. If your number is 0.24 or higher, this is our ideal health. So now you're taking your good cholesterol over your total cholesterol. If you take your triglycerides, I like to refer to triglycerides, I should have said it a couple of slides ago, triglycerides are blood fat. Triglycerides actually come from high sugar, which converts to to triglycerides, which will eventually convert to LDL. So triglycerides over HDL, this is the new benchmark for assessing health. It's an insulin resistance test. This is the benchmark. So yes, you may get that off a specific traditional, but you have to do the ratio on your own. I do ratios 2 to 1. If it's 4 to 1, it may be indicative of insulin resistance. If it's 6 to 1, you got a problem. So inflammation testing, you can get this. There's specific blood lab companies that do it. MPO, myeloperoxidase, is an early indicator of CVD risk. HOMA-IR is basically your fasting blood sugar and responsive insulin. So if your insulin response is too quick or it's too slow, that poses an issue. These are leading edge tests. And finally, a test that is on virtually every blood marker, which should be asked for, is LP-PLA. Assesses the risk of cardiovascular disease. This is an enzyme that plays a role in inflammation of the blood vessels. If it's inflamed, if it's oxidized, the cholesterol is now going to stick. These are 3 that you can get readily here in New York. Let's move on. Whoops. There you go. Hey, look at that. You skipped a number. No worries. Rethinking heart health. I want to debunk some myths. Here we go. Increased cholesterol not the cause of CVD. It is not. High cholesterol is not the cause. It's the oxidation. It's the particle size. It's sugar, not cholesterol. LDL cholesterol is bad. No, it's not good for you, but it's the particle size that's truly bad. So you need that differentiation on every one of your blood tests. I hope I made that crystal clear. Eating cholesterol and saturated fats raises blood cholesterol level. Wrong, you lose at double jeopardy. It is not correct. It is sugar. Saturated fat has not been shown in any incidents to increase CVD. Trans fat, if you're worried about a fat, is the one. That's the stuff in donuts and french fries and the like. Statins, this is my favorite. Statins save the lives of healthy people without a heart attack. Without a heart attack. No. The only time a statin has been shown in literature, anybody can Google this, to be positive to stop heart attack, it's the second heart attack. It doesn't stop the first. Studies on statins have been very specific. There was one with postmenopausal women, and taking a statin increased their incidence of diabetes by 48%. So when you have diabetes, what happens to your incidence of heart attack and cholesterol? Shoots right up. Statins break cholesterol. The breaking of cholesterol leads to an increase in glucose because cholesterol is made of glucose molecules. Also, taking a statin has an adverse effect to your liver, your number one detoxifying organ. And in addition, you get what we call muscle malaise, you get muscle aches. And just as a little FYI, coenzyme Q10, which is a key nutrient to help with mitochondrial function and energy. It's your number one nutrient in your heart. It gets stripped when you take a statin from your heart. It decreases 43%. And as you age, you lose coenzyme Q10. Low levels of coenzyme Q10 have been shown to increase the incidence of heart attack. So I'm not a big proponent of statins, certainly without anybody with a history of a heart attack. And to take it prophylactically, I would have to ask you, why? So let's move on. Blood test for sugar. So we talked about sugar. What do you need to know? You need to know your fasting glucose levels. There's a lot of sugar stuff. This is just basic. You want it less than 100. Fructosamine. Most people don't take fructosamine. Fructosamine is a great marker. It tells me your blood sugar levels over a 2 to 3 week period. And the big guy, hemoglobin A1C. So let's talk about hemoglobin A1C. Essentially, it is a marker of your blood sugar on an average over a 90 to 120 day period. However, it's weighted heavy in the last 30 days. Hemoglobin A1C will depict whether you're pre-diabetic, diabetic, and the like. Hemoglobin A1C should be taken on every blood test marker. It's covered by insurance, and within that, really you'll see people who have a high hemoglobin A1C will ultimately have a lot of health issues and high cholesterol. My marker, I don't care the marker they're using, my health marker is 5.5. You may see up to 6.5 on certain blood labs, 6.0, too high. By the way, we're all worried about our brain. 5.2. If it goes over, we start shrinking the brain. And the marker starts at 4.9. So the point is, you can have sugar, meaning a carbohydrate, you just can't have a lot, and you have to be able to deal with it. And that is the leading cause, going towards cholesterol. The other one we talked about was triglycerides over HDL. It's a great test for insulin resistance, just to reiterate. So I made a comment about sugar and not fat actually raising your cholesterol. How? Well, I made a little flow chart. Carbohydrates come in, gets turned to glucose in the blood. You get insulin activity. So if you have a problem with your insulin or you eat too many carbs, like excessive carbs, where does it go? Well, just so everybody knows, it goes to the liver. So once it goes to the liver, what is the byproducts of those excess carbs in the liver? Number 1, cholesterol. Number 2, body fat. And number 3, fatty liver. So it's sugar, not fat, that's the biggest culprit going towards cholesterol. All right, so I've just given you a dissertation on what's wrong and what to avoid. So everybody's probably asking the question, well, that's great, thank you. What do I do to correct it? I learned a long time ago, I learned as an intern in school, do not come up with a problem. Do not ask the question if you do not have a solution or an answer. So here we go. Here is my answer. Write this down. Share this with everybody. Call me 914-287-6464. You guys got my Facebook. Feel free to email me at info@drrobertsilverman.com. I've got a 1 to 3 month program for people that have high cholesterol. Number one thing I want to talk about in my, what we like to term, dyslipidemia protocols. Lifestyle. Let's change our lifestyle. Man, we just saw yesterday that Obamacare went up for 25%. All these health insurances are going up and people aren't getting healthier. It's incumbent on us to start taking care of ourselves, to enable ourselves to have a positive movement towards a health revolution where we get everybody better. Well, the reason I talk to doctors, doctor means the word teach. The reason I practice so much to speak to you out there is that idea of teaching. If I'm able to help one doctor, that's 30,000 people in their lifetime they'll touch. But imagine the patients who love to talk about it. So please, here it is. Change your lifestyle. Change your lifestyle and adhere to a paleo-Mediterranean diet. The Mediterranean diet has 70 different articles that talk about a decrease in diabetes and are positive for cholesterol or decrease in cholesterol. The paleo is great. I use the term paleo. It's very popular. My premise is the Jack LaLanne is really almost like a paleo diet because he says if man makes it, I won't eat it. So the non-processed food diet, great choice. I got a buddy called Jim Moyner. He's doing a great job at Scarsdale Fit Body Boot Camp. The man's had, I mean, nobody is more motivated than him. He hasn't had sugar in over a year. So kudos to him because I'm a guy who likes to watch what I eat. He got me beat. Powdered nutritional support. I carry a medical food here that has all the specific nutrients that are needed to aid in reduction of cholesterol and reduction in ability to absorb sugar. Omega-3 fatty acids. Omega-3s are a great choice. They're great for decreasing triglycerides. They're a great choice for enabling good blood sugar modulation. And DHA, which is one of the omega-3s that I like to talk about, is great for cell membrane health. We talked about how important cell membrane health is. Something I call omega-10. I have a product here called omega-10 by Metagenics. It's omega-3s plus a purified omega-7, which has palmolitic acid, no palmitic acid, and that combination has shown to decrease C-reactive protein, which is a response from the liver that there's tissue inflammation and also triglycerides. In addition, probiotics. Man, everybody's seen, we've had so many people talk about the gut. I can tell you the probiotics are a great choice. Keeping your gut healthy is going to enable you to keep down your inflammatory markers. And remember, oxidized cholesterol is the problem. If you have inflammation, you will oxidize cholesterol. Everybody should be taking a probiotic, genus, species, and strain. We talked about that before. Give me a buzz, carry the best probiotics, and do me a favor. When you look at that probiotic, make sure you see that third thing being the strain, and make sure it has an expiration date, because if it doesn't, it's already expired. Specialized pro-resolving mediators, SPM. They are not fish oils. Fish oils convert to SPMs. Unfortunately, in our modern era, the host, us, because we're inflamed and we have issues, do not convert the omega-3s to specialized pro-resolving mediators, and they're not the same structure. Specialized pro-resolving mediators, for my money, is the aspirin of the 21st century. It's something we could all benefit from taking. And finally, high-intensity interval training exercise. HIIT, if you will. I was in Arizona teaching this weekend. I had 7 minutes. I did 1 Tabata, but I still got it in. High-intensity interval training is a key component. Exercise will decrease your cholesterol markers. So please, if you haven't already, share this. My goal is 100 shares. 100 shares. Let's share this. Please. I know this is unique to some people. Some of the docs out there, like my buddy Dane at 8 Weeks to Wellness, he's like, Robert, I do this all the time. Big shout out to him. No one's got a better chiropractic nutrition workshop than he does, and he knows all this already. In addition, any questions, once again, feel free to call me. We're going to be doing another Facebook Live this week. Guys, please, let's get on this health revolution. Always yours in health, Dr. Rob. Oh, got a question.
Couple questions.
Excuse me.
At what age should we start being conscious of our cholesterol?
Great question. Teenage years.
Teenage years.
Teenage years.
Another one that came in is, do you do blood tests? You mentioned you do.
Yes.
What's the process? How long does it take? And do you make recommendations once you go through the results?
I love to do nutritional consults with blood tests because what I found about blood is, one, the patient really likes it because they're so used to going to the doctor and getting it. 2, blood tests, though they are a snapshot in time or duration of time, like hemoglobin A1C, 90 to 120 days, still are objective. There's no subjectivity. It's not how we feel. We know that. So they can confirm how you feel, and they can also say how you may feel. So people come in, we script, they get a blood test. Within 5 to 7 days afterwards, we review the blood, and then we start making markers and we start giving protocols based on the individuality of the patient in front of me. And that's really where I differ myself from the competition. Everything in functional medicine and functional nutrition is personalized for you and you. And it's a collaboration between me and you. It's not just looking at a generic number. It's your goal, it's what you need, your age is taken into account, your activity level, your family history. So blood markers, of which I use a lot, I script for, I send them out, you come back within 5 to 7 days, are a key component to actually optimizing any kind of clinical outcome with conditions.
And the last one is, do you recommend a CoQ10 supplement?
I recommend a CoQ10. I have them here, Metagenics, Nutrigems. They're 300 milligrams. I recommend it as a standard thing to take. I happen to take one every morning. If taking statins, I can't tell you to go off them because I do not have a medical degree. But what I will say is, to enable yourself not to have some of the side effects from statins, coenzyme Q10 and milk thistle. Have them both in the office. That's what I would do in conjunction with statins.
You got it.
All right, always yours in health, Dr. Rob. See you soon.